that risk of a secondary cut.
Right.
You're telling me this won't
completely
cut?
eliminated with this.
But
well,
it'll cut.
Let me show you.
It'll cut
stick
bone.
out your hand here.
No, that's okay. It'll
No,
cut bone.
serious. Yeah, watch. Come on.
Well, come on. I trust you and I believe you, but
right.
If it cuts bone, there's a bone in my finger.
You'll be surprised. Watch this. See, we're touching.
Well, it doesn't do anything.
No, it doesn't. But if I take this up to a hard substance, watch what happens. That'll cut right down through it.
It's going right through the bone.
Yep. You see that?
So does that give your patients, I mean, that's a big investment just to not have to worry about accidentally cutting them a little bit.
Exactly. That's a huge investment, but to me,
is that necessary? Do you
it?
need that kind of equipment to do what you do?
There's probably 1 in 100 offices in America with one of those.
So why do you have one?
Safety. I like the fact that patient can feel comfortable with me, can trust me, that their safety is one of my highest priorities.
And you specifically said to me that the level of quality or the level of treatment you provide, you don't need this to do what you do, but you need it to do it at the level you do it at.
That's correct.
And do the patients appreciate that?
Absolutely.
Do you like to tinker with new stuff and toys? Are you a tinkerer? Do you get excited with new? Because you have lasers here. You have the digital I talked about. You've got all the little toys. Is that something, I mean, obviously I do. We're big kids, but do you enjoy the fact that because you are an implant-only practice, because you don't have to spend your money trying to fulfill 80 different roles, that mostly your stuff is spent bringing people the best quality implant stuff, do you like the fact that it gives you the ability to have the latest, greatest stuff?
Oh, yes. Of
course.
course.
Playing with the toys? All right, come on, let's go some more.
All right.
I own Desert View Dental Arts. We have been in business for 25 years in Las Vegas. I only use the best materials that are available. I use the highest grade zirconia that you can make crowns with, the highest grade titanium for the abutments. Everything is just very high end. The materials that are higher end have more translucencies or more natural characterizations like a natural tooth would have. Therefore, you're going to get a crown that looks like a real tooth rather than a crown that just looks like one solid color, or the higher end materials you use, the more natural of a crown. You have to be able to work with the materials also. Designing the abutment to come out of the tissue looking like a prep, like your normal tooth would be if it was ground down to a prep, that's what really makes the crown come out of your mouth looking natural. Dr. Perkins and I like to be on the exact same page when we're starting a case. So I know what he and the patient want to get. Easiest doctor I've ever had to work with because of that, because of the fact that he brings me in the beginning. We talk about everything. We're constantly communicating about the results that we want to achieve. And his ability to place an implant is so good. Patients rave about how comfortable they are. He makes everybody extremely comfortable. He keeps them very educated. He really knows how to tell a patient what they're getting done, why they need this, and what's going to happen to them, when they've finished with the procedure. Well, I know once that they've had them done from Dr. Perkins, they're very pleased with how easy it was and how little pain they had. My father's an example. He had one placed from another doctor in California, and then he came up here and Dr. Perkins placed one, and he was so amazed with how easy it went and how fast it was, and there was no pain involved. He's very easy for me to work with. I have a lot of doctors that I try to work with that, I can achieve the same, but they don't make my job so easy.
I had recently been down to Mexico, Alcodones, Mexico, across the border from Yuma, and I had some dental work done down there, and it turned out to be bad, my worst nightmare. I ended up with lead poisoning in my teeth, implants that were over 30 years old, and crowns that broke off, and an infection in my mouth and all through my body. The challenges in Mexico weren't handled. When I went back, I had the crowns, and he glued those crowns on top of those old implants, and within 30 days I lost them. I went back and tried to get him to fix it. He wouldn't fix it. He wouldn't give me my money back. I had no recourse. I went to the estoppel there, and there just isn't any recourse there. When I came here, I was really a mess, and they had to pull out those 2 implants that I had that were bad, and then they got me healed, and then they did grafting and sinus surgery. Through all of these, I was put to sleep. We brought in an anesthesiologist, and he put me out while the procedure was being done. I did that on the implants being removed. I did it on the implants being put in, and I had very little discomfort. I knew exactly what the procedure was. I knew exactly how it was going to be done. I had a clue how my teeth were going to look when I was done, and it's been exactly what he said it was. I won't go anywhere else. Well, it was wonderful eating my first steak after 4 years. I went 4 years without being able to chew a steak because of my teeth. Very, very gentle. He's a very gentle dentist. Very gentle, very, very soft-spoken. Gosh, I couldn't say enough good things about him. He's a really nice person and a wonderful dentist. It's lifted me. It's wonderful. I used to have the biggest space between my teeth. I used to get teased about missing a tooth in the middle of my teeth. I had such a big space, and now I don't have one at all. My teeth are normally not this big. They're very, very tiny. So he was able to put my teeth with my mouth.
And fit your face.
Yeah, and fit it to my face. So I still can't get used to seeing all these teeth, and they're white and they're pearly. So I'm real excited about it.
First, I want to thank you for allowing my crew and I to bring our cameras out to meet your patients. I've been interviewing doctors all over the country for years. This is the first time I've ever had another doctor or somebody a lab technician actually want to say something about another doctor. It's an incredible thing. So I have to assume that what I've heard about you and what you've told me is true. It's amazing what has changed in just the few short years since I interviewed you in studio. I mean, is it really changing that fast?
Well, if you like what you saw today, you won't believe what's coming. The dentistry that we see on the horizon that's in the near future will shock you how fast it will change.
But the thing, and you know, I sometimes have a different view because I get to see a lot. But you say it's changing like everybody's changing. I still spend time in dental offices all over the country that practice, I don't want to say antiquated or out of date, but they practice dentistry the way it was done when I was a child. Although that was only a few years ago. But is that something that certain people just focus on staying on the cutting edge and other people are kind of content to do what they do?
Well, for myself, Mike, I think I'll probably end up going from maybe 300 to 500 hours a year to, say, over 1,000, just because the things that are out there now that are coming soon are so exciting that I'm very excited to be in this day and age. I'm excited for our patients. I'm excited for myself to be a dentist at this time.
We touched on it earlier, subperiosteal implants. Mm-hmm. Dying art, according to you, because people don't make as much money doing them, and they're really difficult to do. I'm going to ask you right now, can I come back out in a couple of years and see what's new in those? Because I'm sure, knowing you and what I've learned about you, that you're going to make it your goal to revolutionize and bring those back.
Well, you know, it's interesting that you say that, because there is a few people out there that you come back in a couple of years, I'll have some new technology associated. So
right on.
It'll be interesting.
You've been watching Medical News Network. I'm Mike Wittgenstein. For further information on this subject or any other, please visit our website at medicalnewsnetwork.info. Until next time, I wish you good health.